Those 16 years and older are going to be eligible to receive the COVID-19 vaccination. So again, 16 and older starting Monday. Before I get into scheduling, let's talk a little bit further about vaccination for those under the age of 18. Please remember that only Pfizer is the vaccine approved for those 16 years and 17 years old. Anyone under the age of 18 must be registered and accompanied by a parent or guardian. Please, you have to have that parent or guardian with them to get vaccinated and to register. So again, we've talked about this, trying to improve our scheduling process. I think every week we've tweaked it a little bit. But again, another huge tweak for this week, which I think is going to help everybody out. We are excited to announce that we'll be utilizing the new standard state scheduling system. That's going to hopefully make it easier for everybody to locate a vaccine and to be able to get vaccinated. So you can still access the vaccine scheduling through our website, lucascountyhealth.com. But now you can also find appointments through gettheshot.coronavirus.ohio.gov or by simply Google searching Get the Shot Ohio. That will take you to that webpage. So again, a little bit easier for all of us to find a vaccine and to get vaccinated. On Get the Shot, you'll be able to see COVID-19 vaccine providers closest to your home. Appointments are going to be available on a rolling basis. That means no more waiting for 6 p.m. on Thursday to see what's available. Again, we really thank the community for bearing with us to be able to, again, have some time to get those appointments up and waiting to 6. But again, it's going to be on a rolling basis, so hopefully that's going to be easier for everybody. What does that mean? That's going to mean that we're going to be launching it tonight at 12:01 a.m. So as we load the system, you'll be able to start looking for those vaccine appointments 12:01 a.m. Check out our social media page to watch the video on how to actually use the system. Again, it's not totally complicated, but again, it's a little bit newer than what we've been used to over the last couple months. So again, go ahead and take a look at that. You'll be able to search by location for the vaccine sites closest to you within a 20-mile radius. So again, you have that ability to go where you want to get that vaccine. What that might mean for some is that you're outside of the area. You may need to enter a zip code to closest to the Toledo area. For example, if you're looking for an appointment at the Lucas County Rec Center mass vaccination site, you'll need to search by Maumee, Ohio, or use the zip 43537. Again, zip 43537. March 31st officially marks the opening of the mass vaccination site at the Lucas County Rec Center, which will remain open for the next 90 days or so, depending on the need for that site. The site is made possible with the state of Ohio and the Toledo-Lucas County Health Department. And again, all of our partners that are helping out, we really do. The opening of the site means a great increase in vaccine doses that Lucas County is receiving for the community. The average number of doses for county has been about 10,000 doses. With the opening of the mass vax site, we can expect the number to be at 20,000 for next week. And in weeks to come, I'm sure that's going to increase even further. Now, it is critically important, please, people to make every effort to keep their scheduled second dose. We're seeing some individuals who, again, are looking to maybe reschedule that second dose. There is nothing more important when getting the vaccine than to show up for that second appointment. Again, it is really important. This is how we get to the highest immunity in the community. Also, we don't waste doses, and the process makes it so much more easier to keep that second appointment, because again, we don't have to juggle other appointments. And really, if you're not there for your second dose is no longer available. So it's really important to keep that second appointment. The TARDA Vaccine Right Program launched this past Tuesday, March 23rd. Again, great job, TARDA. What a fantastic organization. The health department is committed to reducing barriers to accessing vaccinations. The Vaccine Express is a direct route from downtown Hub to the Lucas County Rec Center on the days that a vaccine clinic is hosted. This is a free ride program running every hour. For more information, go ahead and visit tarda.com and check out that website. Also, TARTA is offering a call a ride for vaccines, which is a door-to-door service available for residents who need to get to a vaccination site Monday through Saturday. Reservations are required, please, and can be made up to 3 days in advance by calling 419-243-7433. Again, 419-243-7433. This service is going to be available in Maumee, Ottawa Hills, Rossford, Sylvania Township, and Waterville. Again, it's a free service as well. Again, I want to thank TARTA again for all their help and their exceptional service to this community. Thank you, TARTA. So we're going to move now into another great segment of Mythbusters. So I'm going to turn it over to Tom Cole and Rhonda Sewell for Mythbusters this week.
Hi, Tom Cole, and welcome into Vaccine Mythbusters. And certainly it's an honor for us to chat with you every week. We're so appreciative of that opportunity. And when I have my partner on, the ratings spike. They go way up. So it's certainly an honor and privilege for me to welcome in my partner, superstar in Toledo. If we can do Rhonda Sewell. Rhonda, are you there?
Yes, I am, Tom Cole. Thank you so much for those kind words. You know, you are such a dear friend and a treasure to this community. I have to tell you some good news, Tom. Like you and your wife, Karen, I got my first vaccination, Pfizer, at Central Catholic High School, Go Irish. And I get my second one on April 3rd. And so I am really happy to be joining the ranks of other community members who have been vaccinated.
Rhonda, so glad to hear that you're on the process of finishing your vaccinations, as many of us in Lucas County are. But with that occurring now, what's your philosophy on people are again starting to be vaccinated in large numbers here in our county? What's your philosophy on wearing a mask with this ongoing?
So glad to be among the vaccinated. And Tom, you always have great resources. We both do with the health department and the V Project. And the vaccine is so great at protecting us from serious illness or even worse, with death. But wearing a mask, I have mine right here, it helps us to stop circulating mild cases of the virus at all. And the key here, Tom, is to have our noses covered. It's good to have our mouths and our noses covered, but the nose goes right into our respiratory system, and it needs to be protected from breathing in and out while we're in public.
Done a little research on the mask wearing, and you know, it is really following the science, and the science is very clear on this, whether it's the Cleveland Clinic, the CDC, or our outstanding health department with the great Dr. Z. They're all emphatically saying, wear the mask. The mask makes a difference. You must wear the mask, protect yourself and protect others. The science is very, very clear on that, Rhonda.
And I do have some sort of good news about masks as well. According to the CDC, this is very important, Tom, you can now gather indoors with fully vaccinated people without wearing a mask. But there's a caveat there. I want to make sure that people hear me correctly. According to the CDC, you can now gather indoors with fully vaccinated people without wearing a mask. But that means that if it's Johnson & Johnson, obviously it's just one shot with the 2-week quarantine. If it's the other two, Moderna or Pfizer, it's both shots and then that 2-week quarantine as well. And then after all of that, you can then gather with people without wearing a mask. They also say, Tom, according to the CDC, that you can gather indoors with unvaccinated people from one other household. So for example, if you're visiting with relatives who all live together without masks, unless any of those people in that household or anyone they live with has an increased risk of the virus. So that's what we've been learning about along this past year. People who have comorbidities or other health risks, you should not go unmasked around them. Speaking
and continuing on the theme of masks, the way your philosophy on the way people wear masks, I know I see sometimes people have the masks on, but they slip down, below the nose. And, I know what your views are on this, Rhonda, but why don't you address that?
Yeah, I mean, it's one of those things where you must keep your mask on. Those CDC guidelines are very important. And I know you've said before, you and Karen, that you look forward to seeing your grandkids. Just another reminder from Mythbusters that you're fully protected 2 weeks after getting that second dose of Pfizer or Moderna, or 2 weeks after getting your single shot of Johnson & Johnson, as I said before. But really, Tom, we need to stay masked up. Let's continue to work together as a community to get us out of this thing. And for more official information, Tom, as always, we want to point people to official trusted sources. And that's the Toledo-Lucas County Health Department and the V Projects, both their website and their social media pages.
It's worthwhile just to repeat one more time. It's so critical that if you're getting the Johnson & Johnson, it's still it's one shot, it's 2 weeks after before you're fully protected. And the same thing for the other vaccinations. Whenever you're getting the 2-shot process with Pfizer and Moderna, it's still 2 weeks after the last shot. I have heard some people say, well, I got my last shot, and I think there's an instant relief that I'm fine, but it's 2 weeks. So that's a very important thing. Rhonda, anything else you want to add to that?
No, I think we've covered it all. We've busted a lot of myths today. And it's always a pleasure, being with you. And I can't wait to see you and Karen in person at a concert downtown or outside. We have this lovely weather going on right now, but, I'm just really excited that people are really understanding the full measure of what this vaccination means.
Well, you brought a lot of good news today on Mythbusters, Rhonda. Thank you so much. And I think we're very grateful for the cooperation of the people in Lucas County. I see, and I know you do, tremendous cooperation on this process of getting vaccinated. And of course, our city and county health people and the city of Toledo, this thing has been organized so very well. It's, you're proud to be a part of it. So I guess we always say, Rhonda, and when we close out the shows, stay safe, stay informed. And I'll also say, maybe on the way out, because we've talked a lot about masks today, Rhonda, be the Lone Ranger or Batman and wear your mask.
Again, thanks, Tom and Rhonda, for that. And I get a lot of questions, and I think we see it on social media. If I still got to wear a mask, why do I want to get vaccinated? Again, the vaccination is important. We just don't have enough individuals vaccinated yet to really forego that mask wearing in public. It's going to come, ladies and gentlemen, but that is so important to continue to wear your mask until we can get enough people vaccinated, so you don't have to really worry. It is coming. We've seen the CDC guidance. It's relaxing inside of homes, and it's going to relax further, but not until we can get more people vaccinated. With this in mind, these have been great times over the last couple of weeks to be able to share information with you through these press conferences. But with the opening up of the vaccine age groups now, pretty much totally, we're going to really consider this our last regularly scheduled weekly press conference. We will come to you in the future as needed. But again, it just is important for us to be able now to get back and focus on messaging what needs to come next. If at any point in time we do need to reschedule press conferences, we will. But I really do want to thank each and every one of our media outlets for, again, attending each week. But more importantly, just getting this information out to our community. You've been such an asset to our community and to the health department and to the hospitals and to the entire medical field of what you've done to be able to, again, to get the vaccine process up and running and continue it the way it has, and all through COVID as well too. So again, my sincere thanks to you. With that, I want to open up to questions.
Amy, go ahead and ask your question.
Hello. So we've kind of seen a rise in hospitalizations across the state, and it's kind of being attributed back to here to Northwest Ohio. Any concerns surrounding that? Do we know what's, attributing to that? What's causing that?
So a couple things here locally in Lucas County. We had our weekly hospital call, and there it seems to be a little bit of a uptick here or there, either in admits or ER visits for some of our providers. Other ones aren't. So I don't think we're seeing that immense uptick quite yet that maybe other areas of the state or our country have seen. As I mentioned earlier this week, we have the UK variant in Lucas County. We know that for a fact now. That could be also a contributing factor to any increased cases. Again, this all goes back to the idea that we still have COVID in our community. We need to get vaccinated, so more people need to get vaccinated. And again, you heard about wearing your face coverings, but again, wash your hands, not going out into large areas where, again, you might come in contact with a multitude of individuals that have COVID. So we still need to do some of those mitigation strategies we've been doing for a long time now.
Do we know what age groups are behind this surge?
I don't know the exact numbers of the age groups. I could find that out for you.
Bree, you can go ahead and unmute yourself and ask your question.
Thank you. I was just wondering if we had, now that we have closer to the date of that MassVax site opening up at the rec center, a better idea of how many. I know you had said before it could be anywhere from 5 to 20,000 doses that you guys could be doing in a week. Any update on that?
Sure. We're scheduled to receive 8,000 doses of combined Johnson & Johnson and Moderna just for the health department. So 5,000 doses or about for Johnson & Johnson and the 3,000 doses of Moderna. We might receive a little bit of Pfizer, I've been told, so we could actually up that a little bit more. But throughout the county, like I said, the FQHCs and hospitals and us, we're closer to 20,000 doses total. That doesn't account for any of the pharmacies that are out there that are receiving doses.
I guess I know we didn't receive any Johnson & Johnson at all just a few weeks ago. Why the change in the uptick in that and less of the Moderna?
So the 3,000 is really what we've been, at least the health department's been getting. It oscillated down or up a little bit over, the last several weeks of Moderna and or Pfizer, depending on what we're getting. The reason for the Johnson & Johnson, and I think the governor's talked about this, is that, again, that federal asset of Johnson & Johnson is being released now. So that is why we're able to get those 5,000 doses. We did get a couple hundred doses of Johnson & Johnson also this week that we're using to, again, pilot that VMS project, that scheduling system. Again, we're going to see more doses being released over the next few weeks of both Johnson & Johnson. I would say that would probably stay stagnant for at least the next 2 weeks, so 5,000 a week. But again, Moderna, Pfizer, I would expect us to also be increased over the next couple weeks.
Thank you.
Caitlin, you can unmute yourself and ask your question.
Hey, Eric. Because of Senate Bill 22, if lawmakers decide to remove all of the governor's restrictions, does that leave you powerless to enforce mask mandates or other restrictions in our county?
Caitlin, great question. Again, I talked to my prosecutor during our board meeting this morning. He gave some input into that. He's going to be looking further into the actual law and then what does that really mean for us. Again, I'm going to be seeking out, and the health department will be seeking out their guidance. Like I said, our prosecutor. I think on the surface it does, as much as we know about it, and can again use the legalese that's in there to ascertain that, yeah, we're probably going to be limited in some things we're allowed to do, which again, depends on how you look at this. We've been utilizing the tools that we have used over the last year for the last several decades. And again, that could be a concern, but as we work through this process, we'll have to figure out how this all pans out for us.
And one more question. It seems like if you want the shot, it's not hard to find. There's a lot of different sites where people can go and get one. Are we still using every new dose that comes in each week, or are we seeing demand slow down a bit at all?
Another great question. Yeah, we are not seeing that demand slow down. Now, I don't want to say that as a broad statement. Beginning of this week or last week, I should say, We had several hundred doses that were still looking to be scheduled, but those were scheduled by the end of the weekend. So we are fully booked. I would expect us to be fully booked quickly over there for the next several weeks, just because of the increase in age group from 16 and above.
Sean, you can unmute yourself and ask your question.
Good morning, Eric. Talking about these variants, we're seeing the UK1 in the county. Are you seeing any others? Are you worried about others? And from a health perspective, are people sicker from these variants? What are you seeing?
Great question. A couple things. Yes, we see the UK, but remember, there's other variants out there. I think the last research I read a couple weeks ago, they were thinking there was 2,000 different variants. Every variant does not make it to the classification like the UK variant, the South African, the South American Brazilian variant, the California variant, the New York variant. These are all circulating right now that we know of, and there's other ones too that could pose us a concern. Am I concerned? Yes. As a public health official, I have to be. That's part of the job. The concern is that we don't know how much more if infectious this is, or is it not as infectious, or the severities. What we're seeing, again, at this point in time, it can be more infectious. That's a concern. And the severity of the symptoms are also greater. The concern that we are needing to really focus in on is that we're also hearing that these are infecting and having severe symptoms, or at least symptoms, because sometimes the kids are asymptomatic, but in children, the younger adults. So we really need to make sure that we keep a handle and an eye on those youngsters and any concerns they might have in those younger adults.
Amy, you can unmute yourself and ask your question.
Branching off that kind of younger age group, a question from one of my colleagues, we're seeing a lot of, the 0 to 19 age group having a lot of cases here in Lucas County. Are any of those, attributed to in-person learning? And is this something of concern for you?
I'm sorry, could you repeat that? You kind of broke up there on my end. I'm sorry, Amy.
Yeah, no worries. The age 0 to 19 age group, we're seeing that number, the case numbers go up in Lucas County. Is that being attributed at all to students going back to school in person? And is this something you're concerned about?
I think we've had schools that have been in person prior to the vaccination program that we've had to isolate and quarantine kids. I think we're going to have to continue that issue and that process, until we get more people vaccinated. Are we focusing in on schools and making sure that they're taken care of? Of course we are. I just had a conversation this week with all our school systems about quarantine isolation. And again, we are starting to see, kids be sick, but again, we would have to look at the amount of kids being sick prior to vaccination versus now. So we'll take a look at that data as it comes in over the next week or two. But again, I go back to this. We have to be vigilant no matter what, whether, again, it's a 12-year-old child or a 42-year-old individual or an 82-year-old individual. We have to take those mitigation steps to make sure that we can stem the tide of any infections, whether it's in school or out of school. So we'll take a look at the data as it comes in and we can get a better handle on it. Excuse me.
Bree, you can go ahead and unmute yourself and ask your question.
Thank you. Also branching off of that, would there be any talks of any more county orders to try and have kids stay home to kind of reduce that?
Again, that would be a conversation between the schools and the health departments with, the idea of having to, do any more orders. I'm not foreseeing that at this point in time. Those are conversations that we do have with those school systems to see what they need. But again, I'm not hearing or seeing extravagant data or significant data that would suggest that we would need to do something like that. Don't forget, CDC just decreased the quarantine area from 6 down to 3 foot. So again, you got to use the science and the data that you have at that point in time.
Amy, you can unmute yourself and ask your question.
Sorry, one last question. Do you have any idea of a rough estimate for next week, since this is going to kind of be the most people that are eligible that we've had yet? How many doses will be available on your guys' end?
Probably close to 8,000, at least from the health department's perspective. Again, don't know if we're going to add any fives to that or not. So again, at least from what the health department can control, we get doses in, we get them out. Very, very seldom are, any, I would say, excessive or significant amount of doses carried over during the week. And the only reason why that would be is that, that clinic or point of dispensing site, they had 1,000 scheduled, but only, 994 came in. And so what do you do with those other couple doses? Again, just kind of an example, you put them in the next clinic, and that might carry over. I don't think, other than maybe the snow week that we had a few weeks ago, that really precluded us from getting all of our doses out in 1 week.
It looks like that was the last question.
All right. Again, thank you, everybody.
We just got one more.
Oh, okay. Oh, Bree.
Sorry. Bree, did you have a question if you want to unmute yourself?
Guys, I'm going to be that person. No, just one more quick question. So how many more people are coming online starting on Monday in the county? Do you have a better idea of that?
No, I don't have a better idea than that. ODH has not shared that with me as of right now. I might go back to my computer and find that out. But I do believe that our providers right now are the same that have been over the last several weeks. Again, I do expect more providers to come online over the next couple weeks. Whether that's again could be the example of a physician's office that has the ability to give the vaccine. So I do expect us to increase providers, but I'm not so sure that we've increased them this week or for next week. Excuse me.
And then, sorry to clarify, do you know how many more people, are becoming available starting on Monday?
Oh, I am so sorry.
I might have misheard that. Sorry.
I misunderstood that. I think to do the rough math, I think it's about 250,000 individuals total in the group, somewhere around there. Again, that's just some quick math, because you got to subtract those individuals who are 15 and below. And so that is kind of the math that you have to do.
Thank you.
Sure.
All right, it looks like that wraps things up.
Great. Thank you, everybody. Be safe, be healthy.